Asthma affects both children and adults and is the most common chronic disease amongst children. According to latest studies, asthma affects more than 300 million patients around the world and across all age groups. Whilst inhaled medication has been the mainstay of treatment for decades, studies have shown that up to 80% of patients with asthma are using their inhaler incorrectly. So how can patients make the most out of their inhaler for the management of asthma? This is EUFOREA News broadcasting from London. Hello, I'm Dr. David Bull and welcome to EUFOREA News. Asthma is a chronic disease characterised by airway inflammation and bronchoconstriction and is one of the most common conditions faced by any doctor. Now, studies have shown that around 80% of patients have poor inhaler technique. The correct technique ensures that the medicine goes right into your lungs, so improving the management of your asthma. Incorrect inhaler technique can actually be bad for your asthma, and when patients fail to use their inhalers properly, it's estimated that only about 40% of medicine reaches the lungs. And that's why it's important to know how and when to inhale using your inhaler when managing asthma symptoms, as the inhalers have a very important role to play to help patients breathe more easily. Well, to tell us more is Dr. Will Carroll. He's consultant in paediatric respiratory medicine at Staffordshire Children's Hospital at Royal Stoke, part of the University Hospitals of the North Midlands in the United Kingdom. He's also editor-in-chief of paediatrics and child health and co-editor of the illustrated textbook of paediatrics. Very good to see you. Thank you very much indeed for joining me.
No worries at all.
So Dr. Carroll, perhaps we could just start by talking through the pathophysiology so we can get an understanding of how these therapeutic agents tackle the disease. So what do we see in this disease?
So asthma is an inflammatory condition. You can't actually see very much going on. So asthma is like eczema of the lungs. And with eczema, of course, you can see on the skin that it's red, it's sore, it's inflamed. But with asthma, you can't really see the lungs. You may feel that inflammation. And I think for those of us who don't have asthma, we have some appreciation of what it might feel like from time to time. So I guess everybody will know that feeling that after you've had a particularly nasty respiratory infection, when you go out on a cold morning, you can feel the cold air hit your chest, and you can feel it's a bit difficult to catch your breath. That is something that happens more extensively in individuals with asthma. And the inflammation in the airway leads to it being narrowed because of the swelling from the inflammation, but also being narrowed because the airways themselves are quite twitchy and reactive, and triggers like cold air or dust will then cause them to go into spasm. And that spasm can be relieved by using inhalers, and the inflammation can be relieved by using inhalers. The tricky bit is knowing whether it's spasm of the airways or whether it's inflammation of the airways, and knowing which medicine to use. And that actually can be quite difficult to work out.
Well, I was going to say that is actually the best analogy I've heard ever, actually, in terms of describing asthma. But I was going to say asthma inhalers have been really the mainstay of treatment and prevention for decades, haven't they?
They have. And I guess if I look back on my career, which I'm terrified to say feels like quite long now, more than 20 years, trying to help children with asthma. If we go back to the beginning of that, I can remember the guidelines very clearly starting off at a position where the mainstay of or the first treatment for asthma would be using blue inhalers, the reliever inhalers, to relieve that bronchospasm when it occurred. And there was a general reluctance or fear in an early stage to use the anti-inflammatory inhalers because they are inhaled steroids. Most parents, many children, don't like the idea of their child taking regular steroids. But these anti-inflammatory steroids are very important medicines. They're fundamental to making sure that we get good control and better outcomes for asthma. So a lot of my time over the years has been devoted to trying to take people away from using blue or rescue medicines and move them towards taking regular brown preventer medicines. And the colours vary. There are different types of preventers and different types of inhalers. But all the rescue medicines, all the relievers are blue, like this.
It's so interesting because obviously we are of a similar age, and that is exactly what we were taught as well at medical school. But one of the things also that really struck me going back all those many years ago is that so many people, I think something like 80%, don't actually use the inhalers correctly. And many people don't even realise whether there is actually active drug in the inhaler or not.
Okay, I mean, two parts to the question. A lot of my interest in the last few years has been about adherence. We use that term to describe how closely people follow the advice that's been given to them by doctors about taking medicines. And the difficulty with inhalers is that it's really easy to get things wrong. It's very difficult to take regular medicines. All patients struggle with taking regular medicines of any sort, but the more complicated it is to take the medicine, the more difficult it is to do. And I think whether you take regular medicines yourself or not, we all have a good understanding of what it's like to have to do something regularly that gives you some benefit, but that benefit is at a distant point in the future. So the example I use when I'm talking to parents often is about flossing our teeth. And I guess most of us, in the week or 2 weeks before we go and see the dentist and the hygienist, make sure that we floss our teeth really well and quite regularly. And then we see the hygienist who asks us, do you floss regularly? And you say to the hygienist, yes, absolutely, I floss very regularly. And how often do you do it? Oh, I do it twice a day, every day, and I'm taking really good care and attention. Of course, you do that for the week or 2 weeks before seeing the hygienist. And then you've seen the hygienist and don't need to see them again for 3 or 4 months. And then your adherence tends to drop off somewhat. I think I see the same challenging in my practice with asthma. People don't like taking medicines regularly. They want to feel well and complete, so they don't take the medicines regularly. And I have that chat and the parents giggle, and then we go, look, if you want to stay well, you're going to have to floss twice a day, every day. In other words, you're going to have to take your asthma medicines twice a day, every day. And once we've won that battle, then we have 2 more battles to address quite quickly. The first is how they take it and making sure they're doing it correctly. And the second is, does the inhaler have any medicine in it? And that second question is a really interesting one that the penny only dropped for me in September last year. And I think the penny's only really dropping for asthma doctors now about. But we'll start with the first part of that, if that's okay, which is how to take your medicine correctly. So the way not to take your medicine correctly is as follows. Here's the medicine. Shake the medicine. Pretend I'm a Bond villain in Casino Royale. Now, hardly any of that medicine has got to my lungs. Just like the Bond villain in Casino Royale, who has really appalling technique for anyone who wants a good video of how not to do it. And yet, all of the media images, the movie images, everything I see on TV about inhalers is all about spraying it straight into the mouth and getting some relief. I can remember a clinic appointment, must be 10, 15 years ago, with a very small child came into clinic. And they must have been 3 or 4. And the mum was determined that the child could take the medicine without a spacer device. And it led to one of the most amusing scenes of my entire clinical career, because there's only one inhaler device you can use without instruction, and that is a cigarette. But it was very clear that this child had followed that instruction of watching their parents, because their inhaler technique was as follows. Go on, you show her. Clearly, you can't see the tendrils coming out of our mouth because this inhaler must be pretty close to empty, which is, of course, one of the problems I'm going to get onto. But afterwards, as the child was exhaling all that smoke, having seen, no doubt, a member of the family going, was in fact the technique that people follow.
Particularly in children, obviously making sure that they have really good technique and the use of a spacer device is certainly of benefit, isn't it?
Absolutely. The medicine comes out of here at 70 miles an hour. And if you've ever stuck your head out of your car window at 70 miles an hour, you know, it's really difficult to get your breath in. It's definitely difficult to get your inhaled medicine in. Of course, it slows exponentially. So it slows really quite quickly. And when it's traveled about 12 centimeters, you can start to inhale some of that medicine. But children's mouths are smaller than adults' mouths, and definitely you've not got 12 centimeters to the back of the throat. So a lot more is going to impact on a child's throat than an adult's. So for all children, we recommend using spacers. And in fact, it's the best way of making sure you get your medicine in well. And it's really simple to use a spacer, and it's really quick. And there are only a few important steps. The first is, and bizarre though I have to tell people, it's remove the caps, shake the device, fit the device to the spacer, and then chin up. Really important to have the chin up. We're going to do sideways on home. Chin up, and then bite and seal, and then we press and breathe.
Well, I was going to say, for children, actually, to try and take those kind of inhalers without using a spacing device is very difficult. The hand coordination, trying to breathe in at the right time, trying to breathe in deeply at the right time. And so clearly the spacer device is really important. Now, you speak about having those two main types, the reliever, the preventer. But we have spoken a lot here on EUFOREA News about the advent of new therapies. How does that then play into the role of treating these children?
Okay, I mean, I'm a firm believer that if you can get most children with asthma to take their inhalers, they're not going to need very expensive biological treatments. They're not going to need anything fancy. Nearly all the young people who are suffering symptoms from their asthma, and they shouldn't be suffering symptoms from asthma, whether that be asthma attacks, very frightening, being brought into hospital, or whether it's struggling with sport or exercise or limitations on activity, all of these things, they are preventable with regular inhaled treatment. And it is about remembering to take those preventer inhalers. And these reliever inhalers are bad news, I'm afraid. They're bad news, whatever format they come in. If you're needing to use your rescue treatment, I use the word rescue rather than reliever, then you've got to ask yourself, why are you needing rescuing? That's the question, I think. You know, if the smoke alarm in your kitchen goes off every time you put the cooker on, there's something wrong with your cooking technique. So, you know, if every time you go out for a run, you need to use your blue inhaler, there's something going on. And the problem is not to, you know, just put something over the smoke alarm. It is to actually fix your cooking technique.
Well, so can I just ask you, though, you mentioned something really interesting there, saying that in children, really inhalers are the mainstay of treatment, making sure you prevent those asthma attacks. You said there that biologicals, those monoclonal antibodies we talk a lot about here on EUFOREA News, obviously very, very expensive, used in adult medicine. You say that children don't, on the whole, need those.
So it depends who you talk to. If I talk to my colleague in Cardiff, who's the lead for the whole of Wales, I think they've got no young people on biologics because they've managed to get all the young people to take their medicines regularly. That's a huge challenge, but they are doing really well. So Wales has a population of 4 million. That sets the benchmark for how well you can do if you get the basics right. And it's getting the basics right that's really important. We can spend millions of pounds on these new medicines, all of which make people who make medicines a lot of money. Or we can get the basics right, and if we get the basics right, we'll do a lot better. outcomes for asthma in the UK are just awful. And one of the reasons they might be bad is because patients are non-intentionally, despite having good inhaler technique, not getting medicines. And the reason became clear to me in September 2021. I was chairing a meeting. There were about 300-400 participants, all of whom are experts in looking after asthma. And someone wrote in the Teams chat, I love a bit of Teams chat, but they wrote in the Teams chat while I was chairing this meeting and talking, how do you teach your patients when the inhalers are empty? And there was a very long pause and a slightly uncomfortable silence. And I punctured that silence by saying, look, we've got 400 asthma experts on this call. Perhaps someone would like to write in the chat how they teach their parents when their inhaler is empty. And then there was an even longer pause. And maybe we can think about that for a second.
So just tell me, so that's obviously the parent's worst nightmare, is not knowing whether the inhaler has any active drug in it. And you shake it, it might feel like it's got some active drug in it. Surely there must be a better way in this day and age where you can see how many active doses are left in that particular inhaler. Isn't that the way to go forward?
You'd have thought. Because I know, speaking to my patients, and I've just seen, I've been around the wards for the last couple of days and seen patients admitted for this very specific problem. Patients all tell, not unreasonably, that their inhalers are empty by the following mechanism. They shake it, they spray it, and they see something come out, which is why I moved the inhaler down so you could see something come out, and they go, must have medicine in it. Makes a noise. I can actually smell the spray here, and they can see and smell the spray, and they go, that must be medicine. And that makes sense. Does that make sense to you, David?
Yes, it does make sense to me. So if we get this right, and you have told me things that I didn't know today.
But it's not accurate.
So that's what I was going to say. So how do you actually know that there is active drug in there?
Okay, so the first 200 puffs that come out of this inhaler have drug in. The next 100, and there are a further 100 doses, will have maybe some drug in for a few puffs, but then just propellant. Just the stuff that drives the medicine coming out. And that, of course, is really quite dangerous if you're using that to prevent an asthma attack, or even worse, if you're using it to treat an asthma attack, you could be putting yourself at significant risk. And to my embarrassment, we've known that since 2004, when Bruce Rubin wrote a paper. And in the United States, where Bruce works, they mandated, well, the FDA strongly advised people that they needed dose counters. But due to the cost, the UK and many other countries did not follow suit. Quite recently, Australia have made asthma inhalers with dose counters publicly reimbursable so they can be used. But in the UK, we continue to use relievers and many preventers without dose counters, which is a real issue for patients. Because I don't know about you, but I struggle to count backwards from 200 with everything else that's going on in my life and keep an accurate record. And I think if I speak to lots of my parents, they say, well, we've got quite a few of these blue inhalers. I've got one at school, one at nursery, one at the childminders, one at his dad's house, one at grandma's. And they've completely lost track of where these inhalers are. So the reliever, your rescue medicine, okay, you've got this rescue medicine to treat that twitch, to treat that bronchospasm. Well, wait a sec, that might be empty and you wouldn't know it. And what's the consequence of that? That means you're having an asthma attack and you're using something and you don't get better. And so what you do is you call an ambulance and you say, help, my child's not getting better. And the ambulance comes and delivers a nebulizer, the child gets better. And then the patient comes to me in clinic and says it's only the nebulizers that work, Dr. Carroll. These puffers, they're no good. I need a nebulizer at home.
Given that you've told me that really the key to success in young people is using the inhalers, using them correctly, making sure there's drug in it, what's your final message? Is it that actually we should mandate inhalers have dose counters on them?
That may not be in my gift, but I think what we can do is we can send a clear message to all of the parents, all of those who are looking after themselves with asthma or looking after other people with asthma, is it's really important to count it out. If you've got puffers without counters, then you need to have some way of counting. That may be a simple manual system of marking it off on the packaging, but it has to be done because relying on the noise is an unreliable method. We are working with people. This is a dose counter that you can fit and then you can use with your phone. And it's kind of in the let's test it stage and see if it works. This can be fitted to a standard inhaler if it doesn't have a counter on it. So this seems like a reasonable solution to me, but there are going to be lots of other potential solutions to help people count it out. It's a really important safety message though. If the manufacturers start to put dose counters on, even better, because they're not very expensive to fit. But the difficulty comes that there may need to be more testing to get devices with counters put onto the market. And if that is the case, it becomes quite expensive. And that cost, of course, will be handed over to those paying for healthcare, which is each and every one of us.
Yeah, absolutely. Well, thank you so much, Dr. Will Carroll. It's been an absolute pleasure. And I have to say, I've learned a great deal from you and some fantastic analogies as well. Thank you very much indeed.
Thank you. You have a great day.
Well, that's it for this EUFOREA news show. Many thanks to my guest, Dr. Will Carroll. Now you can find more information about EUFOREA and register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. And don't forget to follow us on social media on YouTube, Twitter, LinkedIn and Facebook. Until next time, goodbye.